Hi everyone, I'm Georgia, a clinical psychologist from 3P Psychology Service. You're watching Shrinking the Stigma, Speaking with Psychologists. This is where I speak with other psychologists about their professional experiences in order to shed light on what psychologists do, where you might find them, and dispel a couple of myths along the way. Today I'm joined by my friend Val. Val, do you want to introduce yourself?
Hello, I'm Val. I'm a clinical psychologist, mainly specialising with working with children and young people. And today, George and I are going to be talking about general adolescent inpatient units.
Fab. So do you want to give people an idea about a general adolescent inpatient unit, kind of what it might look like, who might be there, those kind of things?
Yeah, sure. So general adolescent inpatient unit is a setting where young people, usually around 13 to 18, they do get admitted, and that's primarily because they don't feel safe enough or can't keep safe in the community or at home. And we can talk about a bit more. But what it means is that usually there are about 12 young people that live together and stay on this unit. It's a really, really big team. So there are psychologists, but there are also psychiatrists, psychotherapists, occupational therapists, and as well as like a learning center or a school. And also there is 24/7 nursing care. So there are always nurses around. So yeah, it's a really, really big team, and psychology is quite a big part of that team.
I think that's a really important point you made, though, that it's got a school in it. It's not like your kind of average hospital where you go in and the ward beds would be side by side. From my understanding, all the young people, they have their own room. There's kind of like a lounge area with like TVs and stuff.
Exactly.
There is furniture. I think the issue with the media, as we've spoken about before, is when you might think of an inpatient unit, which is commonly what we call them, in the media you might see them as, I don't know, in the worst case scenario, straitjackets, that kind of aspect. But in the best case scenario, really drugged up people wandering around like zombies, with no furniture, just like a mattress on the floor.
Exactly. And I think, unfortunately, that is what people think about what inpatient units are. But general adolescent inpatient units are nothing like that. Like you said, there is a lounge. There's usually like some sort of a games room with a foosball table, a bit of snooker. There is a kitchen, when we really encourage young people to there is always food on offer, but there is always the option to cook over the weekend. Young people kind of all get together and cook. There's an activity room, there's an art room, there is lots of furniture, lots of bean bags, and there is usually like a sensory room as well. So yeah, you're definitely not in isolation and you're not in a room with nothing around you.
Are people allowed to leave at all?
So I think my answer to that would probably be, the easiest answer would be yes, definitely. So different units operate differently, and I would say usually general adolescent inpatient units, they're not locked, which means the doors are open. What usually happens is the young people and the staff, whether that's a psychologist, a nurse, an OT, a doctor, they build really strong relationships together. Before someone kind of goes out, there's always going to be a conversation about it, kind of what you're going to do, how you're going to keep yourself safe, what time are you going to come back. And so that's kind of like a risk assessment, that's what they call them. And yeah, then you can kind of go out for a walk, go meet friends, go home. And actually we would encourage that, because you need a break from a unit sometimes, and you also need to do all the fun things that you want to be able to do, like I said, because you're just not locked inside.
Yeah, definitely. And I suppose, to be really clear, when we're talking about being able to keep yourself safe, I suppose explicitly we're talking about suicide and self-harm.
Yeah. So a lot of the young people who probably are admitted to a adolescent inpatient unit, they have maybe had incidences in the past where they have tried to take their life, and they do feel that life is not worth living, and kind of the self-harm is a way to understand that. It's kind of a reaction to that, and it provides relief. But some young people say it kind of makes them feel a bit numb. So so that's what we mean by when they can't keep each other safe.
And when they kind of get to this unit, so they've kind of had their assessment, they've been admitted, they get to the unit, what can they expect from day to day? Like, what activities might they do? How would you work with them?
So there's a whole program that exists on an adolescent inpatient ward or unit. So that's kind of the same term that can be used. What would generally happen is that because school is a big part of it, there's school on every day, and there are probably 2 or 3 lessons, which is very individualized, and that's obviously run by a head teacher and the teachers. And then outside of school, there are lots of activities and groups. So some of the psychologists run group therapy, but also like a social skills group, and that can involve anything from practicing kind of conversation skills and communication skills, learning how to say no, which is often a really hard thing to do for any of us, really.
Yeah, I was going to say for adults as well.
Exactly. And also thinking other groups that psychologists can also run with OTs is lunch cookery. So we do a lot of kind of cooking skills, and the young people choose what recipes they want to do from kind of all these different cultures and different countries. And another thing that is quite big on these wards is there's usually like an outing, which is really nice for the young people to decide. I think sometimes it's the ward that I worked on, it was on a Thursday, and they would decide what they would like, where they would like to go, and that kind of ranges from going to a cat cafe, going bowling, going to Thorpe Park, going to a safari park. And yeah, I think psychologists have a real big role in helping the OTs and occupational therapists kind of plan those activities, just to put some structure in the day as well.
I think that, you know, what I'm really getting from you in terms of a message is, you know, the emphasis on trying to help these adolescents, these teenagers, whatever you want to kind of call them, still do normal teenage and adolescent activities and things you should be doing when you're that age, whether it's going to kind of theme parks or novelty cafes. There's a real emphasis on trying to keep up your education, keep up your social life, and work towards kind of leaving the unit. When you come in, it's not, well, I'm assuming you're not planning on being there long term. I'm assuming it's done on a shorter term basis. Is that right?
So I guess there are 2 types of, they call them admission. So they're kind of 2 types of stays that you would have. One of them is an emergency admission. So sometimes you might need to come in, or children or adolescents might need to come in just for a few weeks or a month, just to get that extra support from a team of people looking after you. And then you can kind of go back into school, and then just if you need that extra mental health support, be seen by a community child and adolescent mental health service. But for some people who feel like they really can't keep themselves safe, and they are at risk of kind of losing their life, then they would stay a bit longer. And I would say on average, people then might stay kind of 9 months onwards. So it is a long-term admission, but it's really kind of individualized and focused and kind of goal-driven as well. And
I'm sure it's reviewed very often. So looking at people's progress and seeing what they feel they need or what's going on. And I'm assuming family are brought into it quite strongly as well.
Yeah, so family, we try and work with kind of family members as often as we can. Part of a team, sorry, I didn't mention this before, there's always a family therapist as well who does see a family once in 2 weeks, I would say. And that's thinking, you know, you could be thinking about loads of things in that space, whether that's thinking about what life will look like when a young person goes back home and how we can support them a bit more. Or sometimes it's really hard for parents when their children or young people aren't living with them and are at an adolescent unit. So sometimes that family space can be used to provide parent support as well. Because it can be, I mean, it does sound, I guess you do have to acknowledge both sides of things, where it's really hard to be on an inpatient unit as well, away from family, away from school, like kind of school in the community and what you would normally be. So yeah, it's about supporting everyone really.
Yeah, I think, you know, like it said, it's extremely difficult to be away from friends, family, your school, your normal routine. But this is a provision that's in place for when things get to a level where it's to an extent life or death, and we are, you know, significantly concerned about someone's life. So it's not kind of an easy decision that's made, that people are just kind of in there really quickly, out straight away. It's a lot of care and thought goes into the process.
Definitely. And I think it's probably also worth mentioning, is that some of these young people are sectioned under the Mental Health Act. And the Mental Health Act exists. It's kind of a law that exists which says that people can be in an adolescent inpatient unit or on a ward kind of without consenting.
Yeah.
And I know that sounds really scary, and sometimes there is lots of there are pros and cons, but kind of the bottom line is that if someone can't keep themselves safe, sometimes as professionals we might need to step in to keep them safe. And so kind of what you were saying, Georgia, it's all about the thinking of, you know, how are we as a team gonna keep this young person safe and support them and help them. So a lot of thought goes into that.
Yeah, and I can see that there's a lot of thought gone into on trying to keep some form of resemblance of the outside world in terms of going to school. I think people are still expected to take exams if they can. Is that right?
Yeah, that's right. So it would, so the school and kind of everyone around would really try and encourage people to go to school, take your GCSEs, do kind of courses, go to college, even if you're on the unit, you go to college, then you come back. But also there's that understanding of, you know what, if things are a bit too much right now, that's okay as well, and you don't have to make it to every lesson.
There's kind of that balance, isn't it, between being compassionate about how difficult things are at the moment, but also keeping in mind a person's future and where we're working towards, because you're not working towards them being discharged from the unit, having not been in education for a really long time, don't really know what the outside world looks like. It's about keeping that sense of normality, so that transition back into the community is as smooth and as stress-free as possible, if that is possible. It's moving is stressful no matter where you're moving to and from.
And it's a transition, and transitions are always really stressful. I guess that's another thing as psychologists. One of the things that we would do is really think with the young people about transitions, of actually what will life look like when you do leave, and how can we help kind of bridge that gap a little bit. And in the unit that I've just finished working at, what we actually offer is something called Leavers Group. And so young people are invited to come back to the unit kind of for about 6 weeks after they have been discharged, just to kind of stay in touch, just to kind of deal through any wobbles, but also kind of reminisce about their time on an inpatient unit, and just to think about the growth that's happened in that whole journey. It's really valuable.
I think also something people might not be aware of is, I know as staff as well, we can, when you're working intensely with those people within an inpatient unit, you develop really strong relationships with them, and they see you all the time. You know, if you're working full time, it's 5 days a week they see you. Those relationships can be really strong. And so when people transition out, sometimes actually one of the more difficult things is losing those relationships. So that group sounds great, that people can come back and visit and see those staff members that they've seen every day for weeks or months.
And you know what, that's what I think makes kind of that environment in an inpatient unit really special. It's the relationships that you build with staff members, with the nurses, with psychologists, with the doctors, but also in the peer group. So usually there are about 12 young people all staying together, and that peer group is, I mean, it's such a strength of the unit. It's such a source of support as well.
Yeah, definitely. So something we spoke about kind of prior to recording, that I've heard quite a few people comment. I know people have asked me questions about it, specifically relating to groups or inpatient settings. And there's a kind of concern about putting groups of people together who are all very unwell. There's a kind of a belief that they might make each other more unwell, they might upset each other, that it's not healthy to be doing that. But obviously that's exactly what an inpatient unit is. So would you be able to talk through how that might not be the correct belief? That might be one of these myths we're trying to work through.
Yeah, so I definitely think that in my experience, that would be a myth. From my experience, I think the group coming together and everyone, like you said, they all have their own difficulties, and in some ways there's more of a sense of understanding then. It's almost normalized. People aren't discriminated, people aren't treated differently, people aren't othered or felt different. And I think it is that level of understanding that then makes the support even stronger. It's such a strong support network. I mean, I do get it. Sometimes as all of us will pick up on other people's behaviors. Sometimes that does happen. There might be some people who might see other people kind of self-harming, and they might then self-harm in those ways. But actually, because you've got such an intensive and such a great team working around this, like around the client, then you do the thinking work around that. So actually, even so, if behaviors are learned, there's always thinking and thought going into it. But I would say more often than not, the peer group is such a support network. In my experience, it's been really nice to see that if a young person is struggling, quite often another young person on the ward will be the first to come around and kind of support, help out, or they'll come and get staff and say, hey, look, you know, XYZ is really having a bad day, could you check up on her?
I can imagine that's almost more powerful, like exactly, having that peer support, like a friend acknowledging that things are really difficult for you and they're coming to you because they want to support you, rather than having your professional kind of always around.
Exactly. So I would say, that's I would think that's more on the myth side of that, it makes people more unwell. And actually, I think they build a community. It's almost like they build a family together. That's what it feels like, actually.
Yeah, and like all families, they'll have arguments, they'll have disagreements, but the support, it sounds like, is there.
Yeah, and you know, that's part of it. And I would argue that that's part of being a teenager as well, kind of being in a peer group, finding where you are, resolving differences, kind of having those fights, but then being able to talk about the fights and being able to talk about differences. And that's all part of it as well.
Yeah, like it almost goes back to kind of the idea of the unit to try and hold on to a sense, like as much normality and much routine as possible. And some of that will be arguing with your friends. That's part of everyday life, whether you're a teenager or an adult, that happens.
And in fact, I think if the young people were all getting on fantastically well and there were no arguments, then as staff we would be a bit worried about that, because like that's not adolescent behavior, and we want them showing some sort of adolescent behavior.
Yeah, definitely. Okay, fab. So we've kind of covered the myth that putting everyone together in one group is a bad idea. But then I think also one of the big ones is the idea of what the media portrays as inpatient is actually very far from what a general adolescent inpatient unit will look like.
Yeah.
And actually it's, from my experience, I don't know if you agree, it's a lot homier than a medical ward. And it looks very different to what it looks like on TV.
Yeah. I think the best way I can describe it, I mean, obviously every general adolescent inpatient will look different. There's not kind of a one gold standard. The best way I kind of describe it, it's like it looks like a really nice boarding school where you've got your rooms, but then you've also got like different areas that you can go to. I mean, sometimes there are general adolescent inpatient units in a hospital setting as well, so you are actually on a ward, but then still they do try their best to make it look not like a kind of just hospital beds next to each other.
Yeah, definitely. Okay, fab. So I think we've covered all the myths we planned to today.
Yeah.
Is there anything, do you think we've missed everything, or do you think we've covered everything?
I think those are the two myths that personally I want to kind of debunk, because it just feels, it's a shame actually when people think about inpatient units as not having any furniture and being in seclusion and not having that peer group, when it's not like that at all.
Yeah, well, I think you've given a really good description of how actually it is. And hopefully if people know someone who's in a unit or going into a unit, it might reassure them a little bit and give them a bit more insight into what the experience actually might be like.
Yeah.
Okay, fab. Thanks so much, Val.
No worries.
Thanks.